So I kind of have a pattern of polling the group at the beginning of my lectures. And I'll start this one with how many people in the group are in private practice? Okay, versus academic practices. Okay, so we have a handful. How many people in the group feel like they know what radiomics means? Okay, so a handful, and kind of fittingly that it's more in the pocket of the academic radiologists in the group. I want to preface this lecture by saying this is not the type of material that we're seeing in our day-to-day job right now, yet. In fact, I think it's still going to be a ways off that we are going to realize the potential of all of this innovation. But at the same time, I think a lot of us that go into radiology, part of what draws us into this field is that is the fun and excitement of innovation and technology that's very much a part of our field. So perhaps I'd like you to view this lecture as something of a chance for a preview of very exciting work that's happening in the background, very much in academic centers, but some very exciting things in my mind. So I want to just start with this picture. And if you take nothing else from this lecture, this is really the one slide that, to me, what this lecture is about. When you look at this one picture, one image from a contrast-enhanced MRI, as radiologists, what do we see? We see an irregular enhancing mass. We might put a size to it. We might look at the contralateral breast and say, no suspicious enhancing masses. But really, what I think we are coming to realize is how much more there is in this image. Really, what I like to call the wealth of information in the image that at this moment, we can't even begin to imagine the power of these images and the clinical information that is embedded with them. And a lot of this work that's happening with radiomics is that desire to find out all of this hidden information that the simple eye of the standard radiologist has no idea how to appreciate. Next step. What do we see when we see the next image? This is this same patient post-neoadjuvant therapy. Our eye, as a radiologist currently, we interpret this as no residual enhancement, indicating a very good response to neoadjuvant therapy. But what else do these images tell us? What is the power that we have in this image showing that kind of response to therapy? To me, that's what's really exciting. And it is so much more than just response to therapy, that this patient really, that tumor responded very well to therapy. It tells us so much more. And part of this lecture will be showing you some of the things that we're finding that this simple comparison of images can tell us.